Hello, I'm Stefanie van Vuuren. I'm a psychiatrist in private practice in Durbanville, and Anthony invited me to do episode number 4 in his series on anxiety disorders. I hope you all watched the first 3 because there's quite a lot of important information there that I'm maybe just going to elaborate on. And I think the background will help a lot to just get a more in-depth idea and feeling of what anxiety disorders are about. And maybe we should start with, in his first episode, he had a slide on what I call the high road and the low road, where if you perceive or if you sense a fearful situation, all the sensory stimulation gives feedback into your amygdala, which is the primitive part of your brain. And from there you get not a reflex reaction, but a very primitive fear response. At the same time, but maybe a little bit slower, there's also the same sensory input goes to your medial prefrontal cortex, which is part of a very important part of your frontal lobe, which supposedly then mediates this response and really has to dampen it down. In anxiety disorders, the problem is that the interconnective pathways between the frontal cortex and this amygdala doesn't always work the way it should, and you really don't get the inhibitory response that you need to dampen down the amygdala's reactive response. With regards to the neurophysiology, 2 neurotransmitters that are mostly involved in these pathways that I've mentioned is the neurotransmitters noradrenaline and serotonin. And the reason why this is important, and we'll get to that a little bit later, is that the medication that we use will also then target these neurotransmitters. When you go to your psychiatrist for a first evaluation, what should you expect? And basically, the first thing that needs to be done, or the mandate of a first evaluation, is to come to a diagnosis. Because if you don't know what the diagnosis is, you wouldn't know how to treat it. Part of the diagnostic workup would be to get a good history, and Anthony already said that part of a good and a thorough history is also to get the family history. So we need to know what your genetic predisposition for the anxiety disorder might be. Other things that might be important in the history taking is to find out about specific stresses that triggered or precipitated the anxiety disorder. The psychiatrist will also then start asking you about your specific symptoms, and Anthony has alluded to all of these in his previous talks. The reason why the psychiatrist would ask about both the genetics and the possible triggering factors is that there is what we call the nature-nurture debate. So how much of what we see is purely genetically driven, and how much of what we see is because of stresses per se. And sometimes it's a combination of both. So if you come from a family that is very highly strung and where there's a lot of other individuals with anxiety disorders, you don't necessarily need a triggering factor. The genetics would be enough. When the psychiatrist starts asking you about your symptoms, it is also very important that we check for all the overlapping anxiety disorders, because that's actually quite common. So you might find in the history of someone with an anxiety disorder that they had separation anxiety as a youngster, later on developed social anxiety, and as an adult had their first panic attack. That's not strange. That is something that actually can be the case. So it is quite possible that you get a lot of different anxiety disorders overlapping with each other. The other important thing is also then to check for possible secondary or confounding psychiatric diagnosis, and one of the most common psychiatric diagnoses that is comorbid to the anxiety disorders is depression, and that is something that we have to check for. Substance abuse is also something that happens very often, especially in the context of social anxiety disorder. We often find that people would say that they would have alcohol before going to a social event because it actually helps them to ameliorate some of their anxiety symptoms. After the clinical assessment, your psychiatrist would also ask some special investigations, and the reason for that is that there are some medical disorders that might mimic some of the anxiety disorders. And I'm specifically thinking about your thyroid. So if someone's thyroid is overactive, they might actually present with heart palpitations or other symptoms that might resemble that of a panic disorder. People with panic symptoms very often complain that they have feeling on their chest, a tightness on their chest, and in all honesty, very often they already come to us having been to an emergency room and having had a ECG already done. But it is important that we check that those things have been checked and that all of that is normal. So after we've made an accurate diagnosis, the next phase of the evaluation is to discuss the diagnosis. I think psychoeducation is a very important part of the treatment. So before we start with psychotherapy or with medication, we first just need to discuss with the patient what exactly their diagnosis means. Because I think that often people find relief if they know what their symptoms, where it comes from, and what it actually means. In the treatment of all my psychiatric patients, I always first discuss lifestyle. So although the things that I'm going to mention now doesn't necessarily treat anxiety disorders, I do think that it's a very good foundation to start. So you have to eat well, you have to sleep well, and you have to exercise. As a psychiatrist, we prescribe medication mostly, and the two main branches of medication that we make use of is the SSRIs, they work on serotonin, and the SNRIs, which works on both serotonin and noradrenaline. So the choice of any of these medications, which in layman's terms is called the antidepressants, the choice of an individual molecule will be determined by the patient's age, maybe their sex, their possible side effect profile, and you choose a specific molecule for a specific individual. Some of the more common medications that are prescribed are something called escitalopram. Sertraline is also a very commonly prescribed SSRI, and with the SNRIs, venlafaxine or duloxetine. If these first-line treatments don't work or is not as effective as we would like, there are other options. Two of the more well-researched options are clomipramine or alternatively pregabalin. If these more first-line strategies don't work, there are also other options that your psychiatrist will discuss with you, and these include other antidepressants like mirtazapine or even medications that works more on dopamine, like for example quetiapine. People very often ask me about benzodiazepines, or the medication that's also called tranquilizers. Benzodiazepines should, as far as possible, be avoided in the treatment of anxiety disorders. And the reason for this is that it's quite addictive. We do sometimes co-prescribe benzodiazepines right at the beginning of treatment, just for the first week or two, just to get people to settle down on their SSRI or their SNRI, but this is something that should be done with your psychiatrist with the idea to withdraw the medication. So I've discussed medication. The other branch of managing patients with anxiety disorders is psychotherapy. And of the different psychotherapeutic modalities available, cognitive behavioral therapy is the one therapy with the best evidence in the treatment of the various anxiety disorders. I've mentioned exercise right at the beginning. I think other treatment like relaxation techniques or yoga is also alternative options to be explored in the management of patients with anxiety disorders. Having discussed all the symptoms that patients with anxiety disorder experience, sometimes they will then ask me, but don't all patients or all people sometimes worry or panic or feel stressed or have heart palpitations when they have to talk in front of people? And the answer to that is that we want to determine if these symptoms has an impact on your level of functioning. So if you can tolerate your symptoms and you can do what you are supposed to do, you can still go outside and go to a shopping mall, or you can get up in front of your class and do your oral, then it's not limiting your level of function and you can reach your full potential. And that patient doesn't necessarily have to be medicated or go for psychotherapy. If there is a limitation on your level of functioning, that should be the cue that you should seek help. There are many over-the-counter preparations that claim to have benefits in anxiety disorders. I've specifically looked at the evidence for products like St. John's wort or CBD, and in the literature that I've studied, I couldn't see that there is good solid evidence that these products work. Sometimes the problem is not that it doesn't work, it's more just that the evidence isn't there, that they haven't subjected themselves to randomized controlled trials, and therefore we cannot come to a scientific conclusion that it is effective in the treatment of anxiety disorders. So thank you for listening to me today. I hope that you could find some valuable information that is useful and that will help you on your journey with your anxiety disorder.